Mark Dungog from Level 1 Section E, and today I'll be performing the abdominal, peripheral vascular, musculoskeletal, and the neurological assessment. Now, can you please state your name, age, and your relationship with the learner, sir?
I'm Lance of the Cruz, 20. I'm a friend of the learner.
First, I'll be performing the abdominal assessment. This is done by inspecting, auscultating, percussing, and palpating. The abdominal assessment is a key in evaluation of abdominal abnormalities, abdominal complaints, such as enlarged organs, distensions, masses, or pain. The materials needed for this procedure are stethoscope, ruler, a pen, clean gloves, and the data recording sheet. Now, sir, let's start. First, I'll be inspecting your abdomen. Is it okay for me to lift your shirt up, sir?
Yeah.
As I am inspecting your abdomen, sir, I can see that your abdomen is flat, which is good. Next, sir, is I'll be auscultating your abdomen. I'll be using the bell of the stethoscope as I'll be auscultating your abdominal aorta. As I was auscultating your abdominal aorta, I heard no bruits, sir. Next is I'll be using the diaphragm of the stethoscope, and I'll be auscultating your right lower quadrant, and I'll be listening for vowel sounds. I am working my way upward in clockwise in all 4 quadrants. As I was auscultating, I heard no bruits in your abdominal aorta, and I have heard vowel sounds in all 4 quadrants of your abdomen. Now that I am done auscultating, I'll move on to percussing your abdomen, sir. Is it okay for me to touch you, sir? Okay. I'll start by percussing your right lower quadrant of your abdomen, and I'll move my way upwards in a clockwise motion. Now I'll be measuring your liver by percussing, and I'll start from the lungs. As I was percussing your abdomen, sir, I have heard hollow sounds from all from all four quadrants of your abdomen, and the size of your liver is 7 centimeters. Next, sir, is I'll be palpating your abdomen. Is it okay for me to touch you, sir, during this procedure? Thank you, sir. First is I'll be palpating your abdomen and using one hand. And I'll be starting from your right lower quadrant. Do you feel any pain or tenderness, sir?
No. None.
I'm moving my way upward and in a clockwise motion. Now, by manually using my two hands, do you feel any pain or tenderness, sir?
No.
Thank you, sir. Now for the special testing, sir, I'll be palpating your kidneys using the duckbill method.
Yeah, sure.
Now on the other side. Next will be the spleen. I see that the spleen is not palpable, which is good. Next will be the gallbladder. I'll be doing the Murphy's test. Sir, can you please take a deep breath in? Do you feel any pain, sir? Thank you. And lastly is for the appendix. Do you feel any pain, sir? Thank you, sir. So the kidneys are palpable and the spleen is not palpable, which is good. And when I was palpating the gallbladder and the appendix, there is no sign of pain, sir. Now, sir, thank you for participating for this assessment. The peripheral vascular assessment provides valuable information on the general health status of the client, and also it can help determine the status of the client's arteries and veins. So, good day, Mr. Santa Cruz. I am Daniel Mark Dungog. Today I'll be performing the peripheral vascular assessment. But before we start, I would like to ask a set of questions for you. Is that okay with you, sir? Did you ever had problems with your legs with your varicose vein?
None.
None. Okay. Did you ever had problems with your calves while walking?
None.
Okay. Next is, do you ever have history of problems with your blood vessels?
No.
So, thank you, Mr. Santa Cruz, for answering all of my questions. Now, so starting off with the upper extremities, can you please extend your arm, Mr. Santa Cruz? Thank you. So far, I see that you have no edema. Now, I am feeling the temperature of your arm down to the fingertips. And I can feel that the temperature of your arm is warm. And so far, I can see that there are no lesions. Now I'll be palpating for the capillary refill time. Can you please give me your hand? Thank you. I can see that the nail beds of your fingertips immediately turn back to its pink color after palpating. Now I'll be palpating for the radial pulse. Can you please give me your hand? As I am palpating the radial pulse, the it is symmetrical and the rhythm is normal. It is regular and the rate is also normal. Now for the brachial pulse, the rhythm and the rate is normal and the pulse is symmetrical. Thank you. Next, for the lower extremities, sir, can you please extend your leg? I can see that you have no edema, there are no lesions, and your skin color is evenly distributed. Now I'll be palpating for the temperature of your legs down to your toes. And I could feel that your legs and toes are warm, which is good. Now I'll be palpating for the capillary refill time. You see that the nail beds immediately turn back to its pink color right after palpating. Lastly, I'll be palpating for the dorsalis pedis pulse. May I have your foot, sir? Thank you. The pulse rate is normal and the rhythm is regular, and you have a strong pulse which I easily identified. It's the same on the other side as well. The pulse rate is normal and the rhythm is regular. Thank you, sir. Good day, everyone. I am Daniel Mark Dungo from Level 1 Section E, and today I'll be performing the musculoskeletal examination. Can you please state your name, age, and relationship with the learner?
I am Christine May Reyes. I am 20 years of age and I am a friend of the learner.
Okay. It is important to do throughout the musculoskeletal examination not only to delineate to the extent of gross abnormalities, but also to look closely to the subtle abnormalities. But before we start, I would like to know, Ms. Reyes, if you have any history of joint or muscle disease.
I don't have
Any? Do you have any problems with your muscles?
none.
Okay, thank you. Okay, so let's start. First, I'll be observing your posture and your gait. Can you please stand up right next to me now? And now, I'll like to ask you to walk from this point to that end, and then going back to the chair. I can see that you have a good posture, ma'am, and you walk normally. Next, ma'am, I'll be assessing your temporomandibular joints or your TMJ. Can you please open your mouth, ma'am? Now, can you please move your jaw outwards? Now move it from side to side. Okay. Thank you, ma'am. As I was assessing your TMJ or your temporomandibular joints, ma'am, I heard no crepitations or clicking sounds. Next, ma'am, I'll be inspecting or palpating your shoulders, arms, and your elbows. Now, next, ma'am, will be your wrists and your fingers. Now, ma'am, I'll be palpating and inspecting your hips, knees, ankles, and your feet. is symmetrical, ma'am, and the color is uniformly distributed, and there are no masses, muscle atrophy, deformities, and it is also mobile. Thank you, ma'am. Next, ma'am, I'll be doing the test of range of motion of your cervical spine. Can you please, for flexion, I'll be asking you to move your chin to your chest. Thank you, ma'am. For hyperextension, can you please move your neck from your chin to the ceiling? Thank you. Now for lateral bending, can you please bend your neck to your shoulder? Now to the other side, ma'am. Thank you. And now for rotation, can you please turn your head from left to right? Thank you, ma'am. Now, ma'am, for the test of range of motion of your lumbar spine, can you please stand up? Now, for flexion, I'll be asking you to bend forward and touch your toes with your fingertips. Okay, ma'am. Now, for the lateral bending, ma'am, can you please bend sideways? Now, for the hyperextension, ma'am, can you please bend backwards? Okay, thank you, ma'am. And now for the rotation, please, ma'am, can you please twist your shoulders one way to the other? Thank you. Next, ma'am, we'll be doing the test of range of motion of your shoulders and arms. I'll be asking you to move your shoulders and arms upward for flexion. Thank you. And now for the hyperextension, can you please move your shoulders and arms backwards? Thank you. Now for abduction, can you please move your shoulders and arms away from your body? Now for adduction, can you please move your shoulders and arms towards your body? Thank you. Now for the external internal rotation, can you please put your arms, shoulders behind your head? Do it like this. Like this. And now you do it like this. And then on the back. Thank you. And now for the range of motion for the elbows. For flexion, can you please put your arms like this? Now for extension, do it like this. Now for the supination, for the pronation, ma'am, can you please do your arms like this? Now for supination. Thank you, ma'am. Now for the test of range of motion of your knees, ma'am. Can you please flex your knees? Thank you. Now, can you please extend your knees or hyperextension? Thank you. Now, for the test of range of motion of your feet and ankles, can you please dorsiflex your foot? Now, plantar flex. Now, for eversion. Now, for eversion. Thank you. Thank you, ma'am. Lastly, I'll be performing the neurological assessment. The neurological assessment helps us recognize and manage diseases earlier in their course. It also helps us detect the neurological disease or injury of your patient and monitor its progression and to determine the type of care that you will be providing. Before we start, I would like to ask Ms. Reyes if you have any problems related to your nervous system.
No.
Thank you. Okay, so let's start, ma'am. First, I'll be assessing your cranial nerve 1. Can you please clear any mucus if you have any?
I don't have.
Okay, thank you. Okay, now, ma'am, can you please Close your eyes. Close your eyes. And occlude one part of your nostril. Occlude one part of your nostril. And identify the scent that you will be smelling.
Mint. Strawberry mint. Strawberry scent.
Okay. Now, now occlude the other part of your nostril, ma'am. And close your eyes again.
Strawberry scent. Mint.
Okay. Thank you, ma'am. Next, ma'am, I'll be accessing your cranial nerve number 2. I'll be asking you to read the book. Okay. Read it, ma'am.
Sandra dries her hands on the towel hanging off the front of the cooker and goes to fill the kettle. The cat, now named Jay by me because, like Gatsby, he seemed to come from nowhere, meows up at her. How was the rugby?
Okay. Thank you, ma'am. Now, ma'am, for cranial nerve 3, 4, and 6, I'll be asking you to follow the movement of this pen with your eyes. Okay, let's start. Thank you, ma'am. Now, for your cranial nerve number 5, ma'am, I'll be palpating your TMJ or your temporomandibular joint. While I am palpating your TMJ, I'll be asking you to clench your teeth. Okay, ma'am. Now, can you please clench your teeth? Thank you, ma'am. Now, ma'am, for the assessment of your sensory function, can you please close your eyes? Close your eyes, and I'll be touching something on your face. Please let me know where you felt it, and if you feel, and tell me if you feel sharp or dull sensation. Okay, let's start.
Nose sharp. Forehead sharp. Chin sharp. Cheeks sharp.
Okay, thank you, ma'am. Now for cranial nerve number 7, ma'am, can you please frown? And now, can you please put a smile? Wrinkle your face. Puff your cheeks. Show your teeth. Raise your eyebrows. Press your lips. And now tightly close your eyes. Thank you, ma'am. For cranial nerve number 8, ma'am, I'll be testing your hearing ability. I'll be whispering a word, and please repeat the word that I'll be saying. Promotion. Promotion.
Promotion.
Okay. Now, ma'am, for cranial nerve number 9 and 10, I'll be asking you to take a sip of water. Here you go, ma'am. Ma'am, can you please tell me your name, the date, and time for today?
I'm Christine May Reyes, and the day today is May 19, 2021, and the time is 4:15 p.m.
Okay, ma'am. Now for cranial nerve number 11, ma'am, I'll be applying force on your shoulder, and please shrug your shoulder as I apply force on it. Thank you, ma'am. Now, for cranial nerve 12, number 12, ma'am, can you please take your tongue out? Now, move it up and down. Now, and side to side. And put it back on your mouth now. Thank you. Now, ma'am, for the motor and cerebral functioning, I'll be assessing your sense of balance. And I'll be doing the Romberg's test. Can you please stand up for a moment, ma'am? And now put your feet together. Put your feet together. And arms on the side. Arms on the side. And close your eyes. And I'll be counting 1 to 20. Okay, ma'am. Thank you. Next, ma'am, I'll be assessing for coordination. We will be doing the finger to nose test. I'll be asking you to touch the tip of your nose with your right index finger. Now, touch the tip of your nose with your left index finger. And please repeat it 3 times. Now, close your eyes and please repeat it 3 times. Again. Okay, thank you, ma'am. Next, ma'am, we will be doing the rapid alternating movements. I'll be asking you to touch each of tip of your fingers with your thumb. Now gradually increase the speed. Now on the other side. Now gradually increase the speed. Thank you, ma'am. Next, ma'am, we'll be doing the assessment of the sensory system. I'll either be touching you with a sharp or light object. Please tell me what sensation that you will feel. Close your eyes.
Light object. Light object. Light object. Sharp. Sharp. Sharp.
Okay, thank you, ma'am. Thank you. Next, ma'am, we'll be doing the assessment of tactile discrimination. Please close your eyes as we'll be doing the stereogenesis. Please have your hand out. Please tell me what object that I'll be placing in your hand. Next, ma'am, is the point of localization. Please close your eyes and I will be touching 2 parts of your body. Please tell me the body part that I'll be touching you. Now close your eyes.
Waist. Chin.
Thank you, ma'am. Next, ma'am, I'll be doing the graffitia. Please have your hand out, ma'am, and close your eyes. I'll be writing a number on your palm of your hand, and please tell me what number it is.
Two.
Okay, ma'am. Other hand, please. On the other hand. Close your eyes.
8.
Okay. Lastly, ma'am, I'll be assessing your patellar reflex. Can you please hang both of your legs freely on the chair? Okay. And I'll be percussing your patellar tendon. Okay. Thank you, ma'am.